Welcome back. Today is Saturday, May the 18th, and today I'm going to do my week 3 video on National Vasculitis Awareness Month, which is in May, and the vasculitis that I have, which is Wegener's granulomatosis. It's also called GPA vasculitis. So this is going to be a 3-part video series, as I'm going to talk about my treatment and the side effects of the treatment. And so I'm going to do one video on chemo, one video on prednisone, and the last video I'll be talking about all the medications that I'm now on. So I hope you guys enjoy this video, and we'll get started. All right, welcome back. We are going to do the third and final video on my 3-part series for week 3. And we are going to talk about my medications. Prior to getting sick, I was on an inhaler for my asthma. That was it. I took a Lager occasionally, but that was all. And now I take 14 pills a day at minimum. I have 2 other pills that I sometimes take depending on my blood pressure, which I'll talk about a little bit. Then I also have a few other medications that I use as needed. So we'll go over my medications and the side effects of them. So the first medication I take every day, I take this 3 times a day. I take hydralazine. I take 100 milligrams. That is for my blood pressure. Prior to getting sick, I did not have blood pressure issues, but because of my kidneys and this disease, I have high blood pressure now. So I take hydralazine 3 times a day. I take Coreg twice a day. I take 6.25 milligrams. They've had to up it. I was at 3.125 twice a day, and they've doubled it. And he is talking about maybe doubling it again because my blood pressure is still out of control. And I take that for blood pressure, and I also take it for my rapid heart rate. So I take that to kind of lower it. I take 20 milligrams of Prozac every day. Now, I took Prozac in the past. After I had my son, I had really, really severe postpartum depression, and they put me on Prozac. I was on it for a couple years. While I was in the hospital, I asked to be put back on it because I was a hot mess. And I'm not so depressed as I have anxiety. I have a lot of anxiety now that I used to not have. So I take that. I take 200 micrograms of selenium. That's for my thyroid. And I take 50 micrograms of Synthroid. I was in a hospital. They did a bunch of CAT scans and MRIs and x-rays, and they found some nodules on my neck. And so when I got out of the hospital, I did an ultrasound, have it checked. And like 2 months later, they called me and said that I have nodules on my neck. They may be cancerous. So I had to go to the endocrinologist, and they did blood work, and turned out my thyroid doesn't work right, so now I'm on medication for my thyroid, which has absolutely nothing to do with the Wegeners. It just happened to be found. But I had to have a biopsy on the nodules. Thankfully, they were benign, and I'll have to have an ultrasound and another biopsy done in a year, but that's not too bad. I take, in the mornings, I take 10 milligrams of prednisone once a day in the mornings. And hold on. And then I also take 40 milligrams of Protonix twice a day, and that's for the gastroparesis for my stomach. And I take at night, I take, the second pill for everything. I take 2 of. And then I also take trazodone, which is an antidepressant that they use for sleep as well. It helps me sleep. I cannot have anything like Ambien or I forgot the Lunestra. I can't have anything like that because of my kidneys. So I started at 75 milligrams a night, and now I'm up to 150 milligrams. It helps a little bit, but not a great deal. But I can tell if I don't take it. It's an optional medication for me. I can take it as needed. But it does, the side effect of that is really, really weird dreams. Like, I've always had strange dreams, and I actually did a vlog about weird dreams. But now I have like extremely weird dreams, like, and they feel like they're really, really long. I don't think they're necessarily that long, but so I take that. I also take Lipitor for my heart, the cholesterol medication. I did not have high cholesterol prior, but he's got me on that as a preventative. I take 20 milligrams of that, which of course I'm concerned about my liver, but you know, what's one more organ falling apart? So then, of course, I have other medications. I have my Allegra that I take, or Claritin. I go back and forth between the two for allergies. I have my inhaler that I take, 2 puffs twice a day for my asthma. I have a prescription for 3 different nausea medications. I have Zofran, I have Phenergan, and I also have, I think it's called clozapine, and it's the strongest one I have for the nausea. I usually try to take that for a couple days after I have chemo. The Phenergan and Zofran don't really work very well for me. I do have them though, but the clozapine or whatever it's called, I take it just once a day versus having to take every 2 to 3 hours. You know, I'll take a Zofran 2 hours, and then 2 hours later I'll take a Phenergan. I also have a prescription for Xanax and a prescription for Ativan. I don't take those very often. I do try to take them before a chemo treatment the night before, because if I don't, I won't sleep. I get very anxious, and I don't really understand why. It's not like I don't know what they're going to do. I don't know what it's going to do to me. It's just a psychological thing, but I'll alternate. One time I'll do an Ativan, the next time I'll do a Xanax. I don't really care for those. They don't do really much for me. They just kind of relax me a little bit, but they still don't make me like real tired or anything. But they're nice to have. And so I cannot take anything over the counter as far as medications outside of Benadryl, Allegra, Claritin, and Tylenol because of my kidneys. So there's a lot of side effects to all the medications, but they all work together to keep me alive, so I deal with it. And at the end of this video, I'm actually going to show you a picture of all the medicines I take. Show you a picture of all the medications I take. I keep them in a pill divider. I have a morning, afternoon, evening, and a bedtime pill sorter. And so once a week I sort them all, so I have them. But I think that's about it. Like I said, these are keeping me alive, and I don't mind taking a minimum of 14 pills a day. I take clonidine at 0.1 milligram. I can take it twice a day. If my blood pressure is too high, I do have to check my blood pressure frequently. If it gets too high, I'll take a clonopine to help lower it really quick. But, you know, I don't take them every day. I don't take them every single day. But I think that's about it. I appreciate you guys watching this video. I hope you found it informative. I hope you liked it. Be sure to leave it a thumbs up if you did. Be sure to hit subscribe and the notification bell if you'd like to see more from me in the future. And don't forget, not every day is good, but there's always something good in every day, and I will see you guys next time.